Disclaimer. This program is intended for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The following program is intended for mature audience only.
Hi, I'm Dr. Kathy Swain Jones.
Hi, I'm Dr. Denise Joseph Zollicoffer.
Hi, and I'm Sonia Williams Finney.
And this is
Menopause Diaries, real talk, real stories.
Welcome to Menopause Diaries, Real Talk, Real Stories. This is a place where we share our life of menopause and hopefully we can impact your life. Thank you so much, Sharon. And if you can just tell us a little bit about yourself and tell us your story. And then this is a conversation, so we'll be going back and forth. So stick with us and hopefully this will impact your life.
Okay. Hi, my name is Sharon Rucker, and I've probably been in menopause about since age 48. I'm 61, and I am getting ready to retire next year. So I'm looking forward to that. I'm looking forward to having my life to myself and not have to answer to a job. And basically, I've been through a whole lot as far as menopause. I think the worst of my problems with menopause, are behind me. But I still have symptoms, I still have things, but I think the things I used to have, I don't so much anymore. But if I can help someone else out, then I'm willing.
And Sharon, that's very normal, though, for women to, one of the myths is that whatever we feel during our perimenopause, we'll feel it forever. And it's really just not true. Once your hormones kind of settle, you start feeling like yourself again. And some people get worn out during that perimenopause for a lot of other reasons, and some women make it through. So it's good for women to hear that there is an end point to it. But the significant thing about that is that a lot of, as African American women, we experience that perimenopausal period a little longer than others, sometimes 7 to 10 years. How long was your perimenopause where you were symptomatic?
Maybe, I think I went through menopause at 48. Well, that's when everything started. Mm-hmm. And that's when I stopped getting the cycle at 48. So really, I don't know. I think I was having things going on before that. During the time I was getting hot flashes, I didn't know what they were at first. They would just come on out the blue.
How old were you then?
Excuse me?
When you first started getting hot flashes, how old were you then?
Maybe 47. Maybe it was like a year before my cycle started, before it stopped.
Yeah.
And so, I would have little things happen, wasn't sure exactly what they were, or didn't recognize it to be perimenopause. I didn't really know because I think my mother once told me that menopause could last for 20 years. I'm like, don't tell me that. I don't know that I recognized everything that was going on at the time.
Mm-hmm. Yeah.
I think that's common. It's very common. I know for me, as I talk more and more to women about what their experience looks like, and even for myself, if I speak from my own personal perspective, there are so many different symptoms that are signs of that you're going through perimenopause and menopause, and I had no idea about half of them, and I was experiencing so many of the different symptoms now as I know it. So I think there are a lot of women that go through and have these different symptoms, and they don't even know that these are indicators that they're going through perimenopause or going through menopause.
Yes.
And we've talked about this before, though. So, and I was about 46, 47, and that's normal for African American women. But I hid it. It was, and Sharon, you and I are around the same, back then it was something you didn't, because a lot of times our mothers and our grandmothers didn't have, it wasn't thought of highly. You know what I
Right.
mean? Like it wasn't a badge of honor. And
Right.
so do you feel like there was some denial in it at all
Well,
or shame? Because I felt shameful that
yes.
that it was happening.
Yes. I felt, first of all, I felt like my mother and my grandmother didn't talk about it.
Mm-hmm.
You know, my
Mhm.
mother didn't talk about it till much later.
Mm-hmm.
My mother is no longer here. She died of lung cancer, but
Mm-hmm.
later on in her life, she talked about it. But I feel like when I first started going through some of these things and way back when, I didn't recognize it. So I didn't talk about it. I didn't
Mhm.
know
Mhm.
why I was having because I went through this, I probably went through a good maybe 5, 6 years of heart palpitations.
Mm.
I had
Mhm.
been to so many doctors, an arrhythmia specialist, everything. I had one friend who told me, you know what? It's menopause. And, I kept thinking something was wrong with my heart.
Yeah.
Yeah.
And I
Yeah.
But
realized,
how did you feel when she said it was menopause? How did you feel about that? Because for me, I would have rather it been a heart problem than menopause.
well,
That's how
right.
I looked at it back then.
I was thinking, does she really know what I'm going through? Someone who was probably 10 years older than me at the time.
Yeah.
I mean, she's still 10 years older, but I'm saying she said it's probably menopause. I'm thinking
Yeah.
that's exactly what it is. But in the meantime, I'm running around with heart monitors on, and I would wake up at night and my heart is pounding, boom, 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 boom.
Yeah.
And then, I'd immediately like feel like my bladder was full. I'd run to the bathroom, I'd come back, and then it would all just calm down, right?
Mhm.
But when it first happened, oh, I ran to the urgent care center because I thought something was wrong.
Mhm.
Mhm.
And so
Mhm.
this was going on. And so now it doesn't happen anymore. Like I haven't had palpitations in probably over like 2, 3 years
Mhm.
because, and even sometimes my heart will speed up from time to time. I know I do have tachycardia, but I don't know, like maybe if I'm dehydrated,
Mhm.
but other than that, if I wake up now and my heart's speeding up a little bit, I'm like, run to the restroom, come back, drink some water, go back to sleep. It goes
You're
away.
you're a pro at it now.
Yeah.
Yes. And it's
Did the
nothing like,
cardiologist ever suggest that it was menopause or
no,
okay.
no. I've been to the urgent care center, the emergency room, and 2 different cardiologists.
Mhm.
Okay. So nobody ever said it was menopause, but the cardiologists were men.
Mhm.
Okay.
Mhm.
So I don't even know if they knew it was menopause.
Right.
Okay.
Right.
But I have a sister-in-law who's going through something very similar. And she's a year and a half older than me. And I'm like, are you sure it's not menopause?
Mm.
She's running all these different doctors. She's like, all this stuff's going on with her. And then I told her too that maybe she should stop drinking wine for a couple of weeks and see what happens.
Mhm.
You know.
Well,
And
Sharon, you made a really good point in saying you went to all the specialists, you did all the right things, but it was your friend who had experienced it. And
Yes.
this is exactly what happened when we start talking to people. It's like, that may be menopause. And
Mhm.
so how many
Yeah.
people who can attest to the fact that they have something similar, heart palpitation, the feeling of the bladder fullness, and then, it's really from menopause. So, you
Right.
know, it's that's why it's so important that we share these things with each other.
yeah.
Exactly.
But about your stories, there was a study, it's called the Swan study. And it looked at women across, nations on kind of how different um nations respond to menopause. And so it's important to know that if somebody does have palpitations or you needed to have that cardiovascular workup. Now the good thing about it is you were good.
Right.
And
Right.
so, because African American women, again, we suffer from heart attack and strokes earlier.
Right.
But the important thing to know is that so many women like you go into the cardiologist, get well, it's not your heart, and then it's left there. Nobody
Right.
thinks
Well, in addition
menopause.
to that, so I take Synthroid. I had my thyroid removed back in 2006. I had a nodule. They said, oh, it's like just a little bit of cancer. We're going to take it out. Okay, took it out. And since then, the cardiologist was saying, oh, it's your Synthroid that you take. And the endocrinologist said, no, it's not. So I was like, well, you two fight it out, you know? So it was one of those things. But what was interesting is the cardiologist, I also had I think it's called an EPS study, electrophysiology study.
Yeah.
And they speed up your heart and slow it down, try to see if they can duplicate what happens.
Yeah.
Because they were going to give me an ablation, but they could not duplicate the problem.
Yeah.
So,
and what we would hope now is that with this awareness, because sometimes we have to be our own advocate when we go, when we have these things. And if the more we talk about, especially the non-traditional symptoms, women can go in and say, okay, I've never had this before. It didn't start until I was 47. My mother actually, let's just say, or my sister started around this age too. Maybe this is menopause, because it's missed. And there's so many, women are medications and testing, and just the fear of that palpitation coming and you think you're having a heart attack.
Yes,
and
you think you're having a
got
heart
to
attack.
get checked because you want to be sure.
Yes, yes. I even took, they had me on medication for a little while. And then when I went to the arrhythmia specialist, he was like, you don't need that. There is nothing wrong with your heart. So I took it and didn't realize that it was making me sluggish. Okay.
Yeah.
So when I came off of it, then I was fine. And I don't have.
Well, the drop of estrogen, for a lot of women, it can manifest in so many ways, but that it can cause sort of an anxiety response that then causes that palpitation that then, and it really is, sometimes it's triggered by the hot flash, and sometimes it's just triggered by daily stress. You're going through something and your body's responding differently to it, and because of the low estrogen. But it's funny that you went that far, and it's wonderful that it was not your heart, but this is just a really good case, because there's so many women, and they lay at night thinking, what happens if if I'm going to pass, or if there's there's so much worry associated with these type of symptoms. So I'm so glad that our audience is able to hear this today.
Yes. And mine would only come at night.
Yeah.
They would only come at night for some reason. And so, after a while I thought, we're all going to die one day. we're all dying. It's just a matter of when, And if I spend my life worried about every little thing, I will go crazy, So.
Well, the heart is a big one to kind of, I mean, it would scare me. You know what I mean? I mean, sometimes I'll get a little indigestion and I'm thinking, okay, let me do all of the things to make sure, what did I eat? Did I take too many omega-3s? How far into it did you say when someone said to you, this is menopause? How long had you been seeing doctors for,
that probably was maybe back in 2011. That's when someone told me that it's probably
how far into the process were you approximately at that point, Sharon?
I was probably maybe a couple years. So when I was younger, probably in my 20s, my heart would feel like it would skip a beat from time to time. But that's it. I never had the fast beating stuff until later. But I also don't know if that had anything to do with having my thyroid removed. Because now you're messing with the endocrine system,
That's right.
So one thing always has an effect, even though they're telling you, oh no, you're fine. But I do know it has an effect, because through the years, my medication for not having a thyroid has changed through the years. Like I always know when it's off,
Yeah. Yeah. Well, and, for a lot of women, perimenopause is that big awakening. All of the things that we were able to sort of get away with or slide under the radar, or, they said I had this, it bothers me from time to time, but not much. That's when it shows up.
Right.
And so what, we want to remember is, especially for those atypical things, and if you go through that round of, hey, everything is normal, perimenopause, and especially for us. And a lot of times, again, 46, 47, and, you know, but for others, it's 50, 51. And so when a 46-year-old or a 47-year-old healthy, strong, active woman comes in, that's sometimes not the first thought. And that's actually, it's just an atypical presentation. Did you ever do hormone replacement therapy or?
No, my doctor did give me what is it called? Vagifem, you know?
Yeah.
So that's it. I take those like twice a week, but he had given me something else for similar, and I was getting headaches. So he changed it to this new one, and I like those. They seem to help me with dryness,
Yeah.
you know, with not having pain during sex because,
Yeah.
and sometimes I still do have pain or feel uncomfortable,
Yeah.
but it helps.
Well, let me ask, how long have you been on so for those of our listeners who don't know, Vagifem is basically a suppository form of a plant-based bioidentical hormone for the vagina, and it's very safe to use. It rejuvenates. I have women actually in their 80s still active and intimate because of the use of that hormone therapy. One of the things that I would say is that if you don't feel like you're exactly where you need to be, you might even want to consider switching over. And I don't know if you did, to the estradiol cream for a short period of time, maybe 3 to 6 months, where you would do a loading dose on the inside and on the outside around the special intimate area for you would do that for 1 to 2 weeks, and then twice a week, because the cream tends to penetrate better inside of inside the tissue. And the other thing that I thought I saw in your little bio is that there was some change in your urinary pattern as well. And so the cream is really good for calming the bladder down and getting all of that under control.
No, I think that's what I had at first. I was getting these headaches, and I don't know if that's what it came from, but once he changed me from that, no more headaches.
Yeah. And so for those women who also can't use hormone replacement or who choose not to, they can actually get some pure organic coconut oil, some suppository trays from Amazon, just melt it in the microwave, pour it in that suppository tray, put it in the refrigerator, and use that twice a week.
Wow.
And so that they could use it on the outside as well to rejuvenate the outer area. And then that coconut oil is an essential oil that penetrates the mucosa. Olive oil you can use too, but I think coconut oil makes you smell a little sweeter than olive oil would be. But all of these things that it's good to know, and just to know for that one option, because you could otherwise, like you said, you were otherwise doing well, but if I'm shut down here, that kind of is a big deal.
Right. Because I was having pain during sex, and then I was feeling so dry. I'm sitting at my desk at work and I'm feeling just like I got peanut butter down. It just felt dry. I couldn't.
Sandpaper.
Yes, it was just horrible. And then it was always the same spot that I felt like, inside was just bothering me. know, and I was like, okay, I can't do this,
Yeah. Well, estrogen is the hormone that keeps the moisture and the thickness to the lining, to the vaginal lining. And so when we lose that, it thins out more and more, just like an 80-year-old skin that you could pull them too hard and the skin tears. That same thing happens. So the beauty though of the cream, number one, the other thing that it can do is you can take some of that cream and put it on the upper area.
Yeah.
And it rejuvenates the blood flow to the intimate area on the outside. The reason that's important is because I have so many women who come in and they will say, well, the only thing that's bothering me is I'm dry and I've lost my sex drive. And so what we do is, and if they're extremely dry, I say, hey, let's go on and let's start the cream. Let's use it on the inside. We're going to use it on the outside and, around the upper intimate area where we get our stimulation. Let's use that and let's do it for about 3 months and then come back. If your libido or your drive has not increased, we can think of something systemic. And the majority of women do not come back, because what happens is when the tissue thins and dries, that clitoris thins and it shrinks and it becomes almost non-existent. So when you're hugged, you don't feel hugged. And so when you rejuvenate that blood supply, when you're hugged, you feel hugged. You don't feel like you're hugging your brother. You feel hugged because there's blood movement there. And
that's good to know.
That's why I always start patients on the cream, and some patients love it so much they're like, don't want to do anything else other than that. And some people don't like some don't like it. Rarely now, because do I have people who just want to use the suppositories because the extra advantage that you get on the outside. And for you, though, you would just use just a tiny bit, because maybe, you absorbed it, too fast. Maybe you were super, super dry. And when you used it, that cream really does get in there, but maybe you absorbed more than maybe somebody else. You probably wouldn't absorb it the same way now because the tissue is much healthier.
Just a short bit about what does bioidentical hormone really mean for our listeners who are saying, what is that, and how is it different from taking an estrogen that, let's just talk a little bit about what it is. Yeah.
So bioidentical means it's made to look just like our own hormones. So when we introduce it into the body doesn't say, what the heck is this? The other hormones traditionally are synthetic, which means they're made in a lab to the best of the chemist's ability to make them look like hormone. And when they come in the body says, I know you have E on your t-shirt, but I don't know what you are. And so it comes in as synthetic. And the synthetic hormones are what led to increased risk in breast cancer. So the synthetic estrogens and the synthetic progesterones, those were the ones that were used in the Women's Health Initiative and were found to cause problems. And so there was a time that we were using hormones, and then there was a time where, nobody should be using hormones. It's harmful to women. That was synthetic. So then the plant-based bioidenticals they're derived from sort of the compounded holistic practices where doctors would compound plant-based hormones for women. And that was actually the original hormone replacement. Is they would take natural hormone from young girls' urine, and then they would make it into a natural cream and they would apply it topically. And then the pharmaceutical companies came in and say, that takes too long. The natural way is not. And they started making making it synthetic so it'd have a shelf life. So the hormones that we use now, the plant-based bioidentical, simply means the estrogen is derived from a plant. The synthetic estrogens are derived from pregnant horse urine, and then they're made synthetically. The bioidenticals are derived from yams. They're derived from sweet potatoes. And then the base cream is a cream. And they're made to look like our body. So there's no rejection as what is this foreign invader? And they're made from a plant base. And I always tell women, if I could just, mash up all these yams for you and send them home with you every day, that's basically what you're getting. And so that is the difference, is that it comes from a plant source and it's made to look like ours. The FDA has approved products, the estradiol, the Vagifem, all of these plant-based bioidentical products are now FDA approved and safe. So FDA approved means when I buy this and it says it's 1% of estradiol, it's 1%. Years ago, when you would go to the compounding, if it was supposed to be 1%, it could be 10%. or 0.1% because there was no regulation on them. And that's why the more natural products got a kind of a controversial name years ago, but now we have all FDA approved sources. Same with if you decided you wanted systemic hormone replacement. We have FDA plant-based bioidentical patches, topical creams, and so they're all safe for women who want to choose that as an option. And hormone replacement, and we'll do a show where we talk specifically about hormone replacement, but it's a good option. It's a good option. It has to be started before age 60, but it reduces our risk of heart attack and stroke. But there are other things that we could do that. It also reduces our risk of dementia if we started early. So at our age, starting it now, and when I turned 60, I was like, should I? My mother had breast cancer, and so I didn't years ago, but I thought about it. But there are other things. So part of the functional medicine side of me knows all the other things that if somebody chooses not to use hormone replacement, how you can prevent dementia also with just taking magnesium threonate, how you can rebalance your body without having to do those things. But for younger women coming up, 45, 46, 47, say they have a strong history of heart attack and stroke in their family, hormone replacement might be a good option or a good choice, before you're 60. So these are all conversations that we want to have with our gynecologists because they're actually protective. And if you're not on a systemic therapy, we'd want to talk about what we want to do to protect your brain so that, because on the flip side, not having the supplements in you will accelerate your risk of getting dementia, Alzheimer's, thinning of your bones, all kind of other problems that could happen without the protective supplements. So functional medicine allows us to provide options for patients and get the same or better outcomes using natural remedies, whereas traditional medicine, either you get the prescription or you don't. And the problem with that is, do you even have enough time with the doctor to tell them what's going on so that you can get the appropriate prescription? Yeah. Well, and I think that's the power of these conversations is understanding I do have options. Yeah. Yeah. I don't have to give up at 60. Yeah. We're just getting started. Yeah. And you said earlier on, you started at, I thought you were 48. Thank you. I thought you were 48 telling me your perimenopause situation. So, and for you, probably having the cardiovascular scare, the heart, the palpitations kind of helped you take a healthier choice moving forward because you were protecting, maybe made better lifestyle decisions, protecting your heart, not knowing that it was your menopause. And you really, you served both very well.
And I think for me, I've always been one to go the extra mile to find out, okay, if this doesn't work. So way back when, before the internet came along,
my dad all remember that.
He gave me a Merck manual, right? Because he used to work for Merck. Yay! So then I would go look everything up, Mm-hmm. And then when the internet came along, I was like, oh, I can Google it now, But you, as you said earlier, you're your own best advocate. Nobody's going to fight for you like you will.
Yeah.
Mm-hmm. And that's why it's important to talk about it.
You have to know your body. You have to know that, okay, maybe you went to the doctor and you got something. You told them that, oh, you're having dryness or whatever, you got something. And then it's still happening. People have to go back and talk about it and say, hey, this isn't working. You just can't, assume that it's going to work. You hope it does, but what if it doesn't, Yeah. So I've always been one to, call the doctor back if something's not right, or, say, hey, I need to come back in and see you, or whatever the case is. Yeah. Some people just say, oh, okay, well, that's how it's supposed to be. It's not.
Yeah. It's a tough climate though. I mean, that's why Denise and I were in the same place in corporate medicine. Big, respected place. Great if you're super sick and you need something and you're about to die or you've got something rare. Right. But I chose to leave simply because there's just no way a 20-minute visit, the nurse takes 10 of that, and I have 10 minutes to help somebody with their perimenopause or their menopause and give them real answers. And so I chose to basically, kind of do my own sort of functional medicine practice to be able to sit here, just hearing your story. The answers are all, and had somebody been able to really take you in as a whole person, and they knew perimenopause and menopause, it's a classic symptom. We don't see it all the time, or how many women are actually menopausal, but the gynecologist will never know it because they sent them off to the cardiologist, and then she was convinced, well, it's just this. You know what I mean?
What's interesting is so when I had gone to the ER about it, then they said, oh, follow up with a cardiologist. Well, the cardiologist we love went to a different practice. So, and our insurance covered it, but at first we just didn't follow him. We still haven't followed him. He's a good guy, really, really nice, knows his stuff. I'm not crazy about the hospital he's affiliated with. Okay. So my husband doesn't care. It's like, if I say we're going over here, we're going, but I care, Okay. But what happened was I had to follow up with a cardiologist. And when I found a person, because everything was in my chart, then she was like, oh, you're here for palpitations. It was right after COVID. And then she's like, oh, okay, you're here for palpitations. No, well, I had palpitations, but that's not why I'm here now. So I felt like she was like rushing me through, didn't want to hear what I had to say. She never listened to my heart at all. She sent me for a stress test. She sent me for an echocardiogram, and that was it. And that's why I never went back to her. Yes.
And so this is our way of just making sure that just for somebody who right now today is feeling palpitations and is 46 or 47 and says, hey, I've gotten all the clearances. Maybe those little hot flashes that I get at night and this other feeling, maybe that is menopause, and they'll go in and get checked and it'll change the course. They won't have to struggle those 10 years or so that you did.
Right. And for me, for hot flashes, so I get hot flashes here and there, not like I used to. I used to get them all the time. Feel like they're just kind of creeping up, but I don't get them so much. I get them. Well, I like red wine, so I get them when I drink red wine.
Or if red wine has a lot of polyphenol, so it's good. It's good for your brain.
Yeah.
So
and it's less sugar.
I've got another girlfriend that says that she has to stay away from the red wine because it increases her hot flashes.
Right.
So it's funny that you're saying that, because I just had a conversation with a girlfriend a couple of weeks ago, and she was like, I only have them when I drink red wine and I love it, but I don't drink it because I don't want to have the hot flashes.
Right.
Something easy that you could do, it doesn't work in everybody, but it works in a lot of ladies, is if you start a vitamin E, if you're able to, you again, check your medical history, make sure you're not on something that you can't take vitamin E, and a B complex. And if you take vitamin E and a B complex on a regular basis, you may be able to tolerate a little bit more. You may be able to tolerate wine.
Right.
Where you're not feeling like, oh, why did I do this? Because then it's
say, why don't the hot flashes come along when you really need them? Like when you're in a cold, like in the summertime, you're in someplace and it's cold, the air conditioning's on, where's the hot flash then?
That's funny. I never thought about that.
Are you taking any vitamin E or B complex?
I take D3, and I take, what's the other thing I take? Those big fish oil.
Omega-3.
Yeah. Omega-3, they're huge. I take those at dinner in the evening.
You probably also need to be on some type of anti-inflammatory. The fish oil is good. But also I'm always like concerned about our brain health. My mother also had Alzheimer's and passed with Alzheimer's. So I'm always, so you start thinking, okay, what do I need to do that? So, that doesn't happen to me. And you might want to look into some magnesium threonate. There are certain different types of magnesium, but magnesium threonate is the only magnesium that crosses the blood-brain barrier. So it reduces the inflammation that causes the plaques, that causes Alzheimer's.
Okay.
And so, again, anybody out there who's listening, make sure you check with your primary care, or make sure there's no reason you can't take magnesium. Most people can, but if you're going to choose a magnesium for whatever reason, and here's the thing. Once we become menopausal, now it really becomes about setting up the supplements that are anti-aging, so they're going to give you the longevity, and these are supplements, and it's from functional medicine. All of our thoughts are derived from the centenarian populations where they live over 100 and 110, that the things that make them able to do that. And so it's the things that they're rich in their diet. And we can have that also, as long as somebody helps us learn that and teach us that. And so for you, I think you've done great, because honestly, you look 48.
Thank you.
But I'd love to see you continue your omega-3. And another one I like is turmeric. Turmeric is also very good for brain health and memory.
And for inflammation.
Absolutely. And your magnesium threonate and your vitamin D3. Those are like,
I had like a powdered magnesium that I would take from time to time, just if I got constipated, right?
Yeah.
But for the last few months, I've been drinking this mushroom coffee. Right?
Yes, very good.
And I love what it has done for me.
Very good.
I think that might be helping my hot flashes as well. I'm not sure.
Absolutely.
But it keeps it. I feel like I don't have the bags in the mornings. I feel like I have more energy when I wake up. I'm not feeling sluggish. I'm regular,
Yeah. So because those mushroom coffees have a combination of mushrooms that are anti-inflammatory, good for brain health, good for gut health, good for energy. Some of them are good for libido. And so everybody can't stomach that mushroom coffee, and everybody's in different, but that is a good one as well. So you're
not good cold.
Huh?
But it's not good cold, but I like it when it's hot. I think if I could get, I have an elliptical here. If I just get on the elliptical 30 minutes a day, I know that would help too.
Yeah.
But
well, put a show on, one of your guilty pleasures, Housewives, or some YouTube, and just get on and just start. And really, a lot of times I tell people, just tell yourself, I'm gonna do 10 minutes and do 10 minutes every day for a week, and then the next week it's gonna be, you'll be at 50, and you'll actually feel like doing it.
Oh, definitely. So when I was working out on a regular, I did very well, but I think what happens for me, if I don't work out in the morning, I'm a morning person, if I come home from work, that's it. I'm like, I'm not thinking about exercising, but first in the morning, I can get up and exercise, and I could build my way up to the, 30 minutes. I was doing it for a while, and then I go in there every now and then, do it now. But
how
I see
about
people walking outside all the time.
But how about Pilates? That's what I do.
Oh,
Pilates.
I did Pilates.
And Pilates classes start at 6:30 in the morning.
Yes. So I did Pilates. I did a trial, like a free class. And a friend recommended it to me. It was great. But I was like, okay, if I pay for this, am I going to use it? Because I know I pay for dinner now.
You will. You will. I mean, it's truly, truly amazing. And especially, it keeps your body, and I always say, we got to be able to bend your arm,
keeps your body flexible and limber.
Yes, that's right. I had a head injury a couple of years ago, and I had one day I had dropped and I had vertigo really bad, and I just hadn't worked out for a long time. I got so weak, and I dropped a pin. It went under the bed, and I went to go to get it from under the bed, and I couldn't get back up.
Oh no.
And so I said, I've got to do something. I joined Pilates, and now I am going to be the poster child for November. And they're right up. Hey.
Awesome. Congratulations.
It keeps you, it's an easy way. It's meditative. Because when and do the one that's on the reformer, you can meditate, you're listening to the teacher, you just move your body and you start where you are. You don't have to be, and before you know it, you will, you'll definitely see results right away, but you'll get stronger, leaner, and it helped my mind. It pumps the blood to your brain and all of that. But you do have to find one exercise that you like. So that's what I would say is maybe even just go get a little temporary 1 month and try to go every day, or not every day, maybe 3 times a week.
I'm going to try to revisit that.
Intro classes. Most of those Pilates places too, they give you like an intro class where you can go and try it.
That's what I did. I did the intro class.
Yeah.
And then when I looked at it, I was like, well, do I want to spend the money on this? I'm like,
well, go find one that gives a package. Like I started with the 8 class a month.
Okay.
The 8 class a month package, and I would go, I would go twice a week. And that was back when I was still working, and I was working 14 hours a day for the hospital that only gave me 10 minutes with each patient. And so I would go on Saturdays and Sundays. And then now I can go more. But and even Saturdays and Sundays, I didn't miss. It changed my life.
Okay.
Yeah.
Well, guys, unfortunately, we are running out of time.
Okay.
But it has been such a rich discussion. Sharon, thank you so much for sharing your story. Kathy, you were right on. I loved everything that you were saying. And for those of you who are listening, you can put on our podcast as your guilty pleasure when you go to exercise, like Dr. Kathy has just recommended.
Oh, yay.
Listen to Menopause Diary. We've got lots more to go. Just to kind of recap a little bit what we talked about, one of the things that I think was very, very valuable, Kathy mentioned all the vitamins and supplements that are so important for our health, and using bioidentical hormone for vaginal health. I think that's super, super important. And so you can go back, have conversations, be your own advocate like Sharon was, and keep going until you find someone who's willing to listen to you and understand you and put it all together for you. So thank you so much for joining us. We're so glad that you guys all tuned in today, and please listen to our podcast, share it, like it, and tune in next time. Any final words from you, Kathy or Sonia?
Yeah, I did want to say, for any of you who are struggling or just want to kind of know more, hear more, you can find me on Instagram, Dr. Kathy with a C, Dr. Kathy Jones. Also, my website is womenshormonewellness.com. And like I said, I'm no longer in corporate medicine, just to be able to serve women at a higher level. And so I am doing some free initial consults just to kind of see where you are, to kind of do what we did today. Hey, let me hear your story. Let me help give you some direction. So for longevity, give you direction, to help for the second half. So our second half is our better half. So again, that's Dr. Kathy with a C Jones is the Instagram, and then womenshormonewellness.com is my website. And you can go to the Instagram and just click the link in the bio, and that'll take you to the website and all of my other, and go on and subscribe. That way I'll be doing some webinars, live webinars and Instagram lives. And that way you'll always be notified when we're on. Yay, that she is.
I found you.
There you go. So yeah, go on and since you pulled it up, put on your notifications because I'm going to be doing a webinar soon, and you can get on for that live webinar and kind of hear. But I'm here for you guys, and so just reach out if you need anything.
Thank you all so much for having me.
Oh,
thank you, Sharon. We appreciate it.
Thank you for joining us.
Bye. I'll be listening.
Okay, right, guys. Till next time. Bye-bye.
Bye-bye.
Bye.
This is Menopause Diaries, real talk, real stories. Thanks for listening. Let's thrive together through every hot flash, mood swing, and sleepless night. Don't forget to like, share, and subscribe to Menopause Diaries, Real Talk, Real Stories. If you have questions or want to share your story or would like to be a guest, visit us on Instagram at Menopause Diaries Podcast. Let us start a conversation and navigate this journey together.